Good evening, good afternoon, good morning for where each of you are at across the world. Today we are thrilled to present you with a discussion about best practices for medication safety in the U.S. So I'd just like to welcome everyone here. If you want to type in the chat where you're here from, that would be great. And so really now we're just going to dive into what medication safety is here in the United States. It's a critical aspect of nursing practice in the United States. We focus on it very consistently. It's really important for us to ensure that we've got safe medication administration, and sometimes that varies across the world. Next slide. And so let's really talk about why it's so important to have medication safety. We know as nurses that we want to make sure that we've got great patient outcomes. We don't want an issue with a medication to have significant harm to a patient. We need to make sure that we're focusing on the right patient. And really, as a nurse, we play a critical role in safeguarding medication processes. Welcome from Ghana and Iran. Thank you for joining. Next slide, please. Hello from the Philippines. Good evening. And so here in the United States, we have 5 rights of medication administration. Now, this may be similar to the country that you're practicing in right now, or it might differ a little. So let's talk a little bit about this. The first thing is we always want to ensure we have the right patient. We always have to use 2 identifiers. Primarily, we use the patient's name and their date of birth. The other aspect is that we want to ensure that we've got the right drug. We want to make sure that we're giving the right medication to the right patient. We also want to verify that we've got the correct dosage. And we also want to make sure we have the right route. Is it intravenous? Is it oral? Is it an injection? And then at the right time. We want to make sure that this drug is being administered to the patient at the right time of day. Welcome from the Bahamas. If you have any questions, please type them in the chat. Next slide. And so in the United States, we do have some additional safety measures that we do follow. So I'd like to kind of just dig into this a little bit further. So we have double check high-risk medications, so like insulin or anticoagulants or opioids. These require extra caution and also require second signatures. So whenever we give a controlled substance in the United States, we have to have another nurse watch us draw up the actual dosage into the syringe. They verify that you've drawn up the correct dosage. Then you want to make sure that any sort of vial that you're pulling a medication out of, we only use it as a single dose. So you want to make sure after that same nurse watches you discard that medication and waste that medication. That's a critical piece of medication management here in the United States. The other aspect of that is it's extremely important that you're documenting this information into the electronic medical record. In the United States, we have electronic medical records at each one of our healthcare systems. And in that, we needed to be documenting the medications we've given, ensuring it's the right patient, the right dose, and then we have any appropriate second signatures that are listed into the electronic medical record, verifying that you gave the right dosage to the patient. A big part of this is that we do use technology in the United States. Not only do we use our electronic medical record, there's a handful of medical records that the United States uses, such as Epic, Cerner, Meditech. But in addition to that, we also have medication management systems. And you might hear this, there's a variety of different manufacturers that have medication management systems. And they're basically like an electronic pharmacy where it's a machine that you go to. You scan your badge in order to access it. And sometimes it's referred to as Pyxis or Omnicell. So just be aware of that. Another aspect of medication management in the United States is to make sure that prior to giving the medication to a patient, you're going to want to explain to the patient what medication you're giving them, why you're giving it to them, answer any of the questions they may have, and then also talk about any potential side effects that they might have from the medications. Another aspect of this is if you're taking if you have an oral medication and it's actually in a package, when you bring it to your patient's room, you have to open the package and physically give the medication to the patient and have them then take it in your presence. Next slide, please. And so in the United States, we want to make sure that we share with you that we want to create a culture of safety. So we know as nurses, there are situations that we may see an error, we may make an error. Maybe we have a near miss where we were going to give a patient a medication, but we identified it wasn't the right medication or it wasn't the right patient. And in the United States, we really function at each one of our health systems by encouraging nurses to have a voice and to report any sort of mistakes that they have without fear of any sort of retribution. Sometimes in the United States, we call that just culture. And it's basically empowering nurses to be able to voice any sort of concerns or any sort of issues, and then really participate in continuous education and training on medication safety practices. Next slide, please. And so in the United States, we really do have a variety of different strategies that we use so that we always have continuous process improvement. And so some of the things that are done is our pharmacy systems do regular audits of any medication that's been given and look to see, are we following the processes that have been established. Also, if there are any errors that are reported, there's always a feedback loop in order to talk with the nurse, talk about what was done right, what was done wrong, and then just closing the gap of where you needed to improve on that performance. And then there's also, if there's consistent challenges with administering medications, at times they'll implement corrective actions in order to educate you further, and also to make sure that they're monitoring that to see that you can be successful with that. I do see a question that's here. Can we get more insight on Epic? So yes, I'd strongly encourage you to actually go to YouTube, type in Epic EMR, and there are tons of videos out there that health systems across the US have listed and have published. And it's a great way for you to get an initial view of what does Epic look like? What does it look like to document medications or to document your nursing notes in that platform? Epic in the United States does not allow us to scale the platform internationally. They only allow the platform of Epic to be used throughout the United States. And so that's why we can't really, provide you with a real-time view of Epic. But on YouTube, you can see all of the training modules that different health systems have published out there to kind of give you the initial view of what Epic is. Next slide, please. Okay, so if you have any questions, please type them in the Q&A. I'd be more than happy to answer any questions you have.
Hello, Laura. So we're on a Q&A session. So I'm just gonna help our nurses to ask questions. So how about this question? Like, can you describe a situation where a language barrier impacted medication administration? Yeah, because for international nurses,
Sure,
sometimes
sure.
language barrier can be. Mhm.
Absolutely. So, if I think a big part of this goes back to the five rights of medication administration. So, number one, making sure that you're looking to make sure that you've got the right patient, right? We talked a little bit about that from the beginning, about verifying the patient's identity as far as um, asking them their first name, asking them their date of birth. The other thing you can do is that they'll have a wristband on their wrist where you can actually look to see their first and last name and verify it that way. Perhaps maybe you didn't understand what the patient said. That's a way that you can double check that you have the right patient. We also use barcodes. So on the actual wristbands, there's a barcode, and within our electronic pharmacy systems, there's a scanner that you scan the actual patient's bracelet that actually has that barcode on there. And that's another way that you can have another way to identify a patient, but we always use two identifiers. And if perhaps you aren't able to identify that, I would encourage you to pull another nurse into the room with you to help you to make sure you can get past that and that you verify you've got that right patient.
All right, thanks, Laura. And you mentioned about barcode, and we have like a follow-up question from Kogo. He said, explain to us how barcode medication administration works. Is that the same thing that you just mentioned?
It is, but I can talk a little bit more about it. Great question. Um, for we have electronic pharmacy systems, and so in order to get a drug out of the system, it uses the actual patient's barcode. So many times we will have patient labels that you have for each one of your patients, and then when you're at the pharmacy machine, you scan the actual patient label that has a barcode for that individual patient, and it will open up the medication that you're looking to give the patient. And the reason why we use that in the United States is to prevent medication errors, so that we're hardwiring a process that we're pulling medications out of the machine for the correct patient.
All right, thanks, Laura. And next question. Have you encountered a situation where a patient refused medication, and how can we address that if we will encounter that in the future?
Great question. Yes, that happens all the time. A patient may say, I don't want to take that drug. And the best way to kind of close the gap on that is really to say to the patient, I understand you don't want to take the drug. Let's talk about what the drug is for. And then by explaining why the patient would receive that drug, how it would help them. So that if it's a pain medication, you can say, Mrs. Jones, you know, you told me earlier that your pain is on a 10 out of 10. This drug is going to help to reduce that pain. These are the side effects related to that. Mrs. Jones, do you have any questions? And really sitting down and making sure that the patient understands what value that drug is going to give to them. And if you've had that conversation with the patient and the patient refuses to take the drug, then you're going to go back and you're going to document in the electronic medical record exactly what you did, that you encouraged the patient, you answered the patient's questions, you explained what the drug was for, but the patient is refusing the medication.
All right. We have like more questions coming in, and this question is from Priscilla. When using a barcode system, does it still require two nurses to counter check the controlled drugs?
Yes, yes. In the United States, any controlled substances have to have two nurses' signatures, both for pulling up the right dose of medication out of the vial and also wasting the rest that was in the actual vial.
Thank you. Another question is from Fernando. Can you discuss about your process of medication administration during cold blue management or resuscitation in the ER?
Great question, Fernando. Absolutely. So we basically have a what we call a crash cart. The crash cart has all of the medications to manage an emergent situation that's occurred with a patient, such as a code blue, that doesn't require the barcoding and the scanning. And so you have full access to any sort of medications that you need for a code blue. And that's both in the emergency room, and that's also on the general medical floor, such as a med surg unit. Every clinical unit in a hospital in the United States has a crash cart. That crash cart is pulled into the room when a patient has a code.
Okay, awesome. Next question. Let me just pull that up. How do you handle situations where patients experience adverse reactions to medications?
So as soon as you'd have a patient that had an adverse reaction, you would immediately notify either the physician or the resident, if it's a teaching hospital, that they're having this allergic reaction, and then get additional orders from the provider.
Okay, so another few questions coming in. This is from Red. What administrative controls are in place to ensure medication safety and accuracy during periods of understaffing or high workload? And how are these controls monitored to prevent errors?
Great question. This goes back to our medication management system. So the Pyxis or the Omnicell, that's actually the technology where we remove the medications from. Some of the controls that are in place is the barcode scanning. It is also, there are audits done on how you're pulling off medications out of that machine, and that then they also, on each clinical unit, manage any sort of adverse events or highlight where nurses didn't follow the processes. And these are the controls then that are monitored to say, how many times did this nurse, not follow the procedure to take medication out of the medication management system.
Okay, thank you. Another question is from Kelmy. What if there are no nurses available to double check the medications? I think this is like a follow-up from the question a while ago. Can you do administration on your own, or should you wait until there are nurses available to double check?
Yes, for high-risk medications such as controlled substances, you must have another nurse. And so what I would say in that is, if you do not have another nurse, do you have a nurse manager or a nursing supervisor that's there on the clinical unit? If they are not there, then you would wait until there was another nurse available to double check.
Okay, thank you. So I haven't seen any more questions. So let me just check. Still people coming in. So if you have any questions about the topic, please type them in, and we will try to answer them all. Just give me 1 second.
Thank you, everyone, for the amazing questions.
Okay, here's another question. How do you ensure proper communication with doctors and pharmacists to prevent medication errors?
So I think there's a combination of things that occur in that. Number one, you're using the electronic medical record to obtain any of your physician orders, what medications that the physician's ordered. And then secondarily to that, pharmacists do have to check the actual orders to ensure that it is the right concentration, the right dose, etc. If it is not, if the physician wrote an order that is not an accurate order, that pharmacist will not fill that order, and they will contact the physician to make sure that the order is updated.
Okay, thanks, Laura. I think that's it for our Q&A session. So I haven't seen any questions from the chat. So moving forward, please like us on Facebook, follow and like us on Facebook to get updated and for immigration updates and new positions. And we are always doing webinars weekly. So follow us on Facebook to get in touch. And also I'll put that on the chat. And next one would be our Refer a Nurse program. So we have this amazing program that you will earn up to $250 if you refer your nurse colleague. Okay, so Laura, any last thoughts?
Thank you, everyone, for attending.